The navigator would take you through, like, every step of the process and just kind of outline the steps that you need to take and where you need to go so that you're not constantly scrambling to try to understand what they're talking about. It's easier to say, go to building B and door 7. Um, and here's what you need to bring. So just kind of so that you can focus on your own care rather than just drowning in, red tape and complexities.
But is there an advocacy group within the health authority or the IWK? Like,
maybe there's a better role for nurses or nurse practitioners in our systems, so that we can, kind of protect the specialists. And maybe they could help share some of the information with the patients instead of always taking the doctor's time doing so.
One is a very minor one, and then there's a more global one. But the minor one is, why is it that they can't have a Johnny shirt that actually ties in the front, that is intended to be put on to fasten in the front, so that when you're going in for a breast exam, you're not taking a Johnny shirt that's intended to tie in the back and having to put it on and it never fits properly. That's the minor thing. I would think that with, a hospital or an area that's focused on women's care, they could have a Johnny shirt that did that. But the more global one is coordination. So someone talked about sort of the whole person, but when you're dealing with more than one medical issue, and you go to, I go to the breast surgeon, all he wants to know is about how I'm doing with that, but I mean, I was diagnosed with breast cancer and uterine cancer within a month of each other, to try to see, is there maybe some underlying thing that could be contributing to all of these pieces that are being treated? Mm. So I'd like to be treated as a whole and not as a series of pieces. That's the type of person who could help coordinate various segments, make sure that, family is properly informed and involved, and that the patient knows that if there are other areas where the person is being cared, that there's some coordination between it. Isn't the IWK, but just as an example, they have that little cardia thing where you can put your fingers on it and it does an ECG for you.
Email or text, or I have a friend who actually used to email her doctor. This was in another province, and I think it was just because she was critically ill, and he gave her his email. But I thought, how cool was that? Like, she just had a quick question, and she emailed him, got a response that day, and off she went. So it was, something like that would be really cool. It wouldn't have to be the doctor; it could be somebody else replying, but.
Mm-hmm, mm-hmm. And that could be at the IWK as well. So you've got something coming up, you want to find out, you have questions suddenly that pops up, you're able to actually email and get a response right away to one question or something.
My sister, just pre-COVID, was in England and ended up with an infection, asked the hotel, and they said, oh, well, there's a place you can go for a virtual consultation. It's basically in a pharmacy, but a doctor came on. So, she was seeing the doctor, and she was able to get a test done at the pharmacy that he could make a diagnosis, prescribe her a prescription. And, it didn't take her very long. It worked really well. So, something like that, if you could have like some stations like that in different places that, they could be in, I mean, certainly there are blood pressure machines that they can take your blood pressure and be able to tell that you don't have to go in the office to have somebody take a blood pressure for you.
It would be nice if everybody could have that experience. Not everybody has the finances to do that. So I think if there was some way to, there was mention of a hotel. I just pictured Disney. And I just think, like, wouldn't it be cool if there was like I know it's not little, but like the train, like what if you could just hop on that train and go right to that really cool IWK hotel and like there was a pool and a slide, and then you could just go for your appointments and come back to your room and it was all inclusive.
The whole experience, not just within the facility, but kind of extending that caring feeling. If I hear
Yes.
you well, extending that caring feeling for the family,
Yeah.
for the surrounding elements of the experience.
And they really haven't updated anything. It kind of looks run down. You know, the last time it I guess because it looks run down, it kind of makes it feel unclean. I know it's not. But it definitely needs to be freshened up if nothing else. But I do love the idea of the train track, you know, so that you know where you're going, and you know the color coded elevators, and it does make it really easy to find where you're going. So I hope that they don't get rid of that, or they find something better so that, you know, there's something for all ages, you know, have somewhere for the little kids to play, have video games for the older kids to play. If they had a pool, it would make it that much better. Like just accommodations where they had a pool, maybe a games room set up for the kids so that, you know, there's something for all ages, you know, have somewhere for the little kids to play, have video games for the older kids to play, you know.
Mhm.
So, and then the other thing that we had trouble with while we were there was food. You know, number one, food's expensive wherever you go, especially when you're eating out. And I think, you know, we're talking about technology and kind of bringing the IWK into the, you know, the current technological times and launching them into the future. To check in, you could probably do that yourself virtually, either through an app or through a kiosk that they had there, you know.
Mm.
And I don't want to take somebody's job away from them, but it, you know, it would streamline the process a little bit and maybe get things going a little bit faster.
So I feel like that kind of information should be also sent out with your first appointment or even at every appointment, because I don't think it's because I get the letter anyway. They might as well throw an extra page in. Just kind of, you know, more being more welcoming. They could be more welcoming, welcome you to the IWK, and it's going to be fun and it's not going to be scary. It's going to be really great because we're really awesome. And then, like, I don't know, there could be, you could say, like, there's in this area, there's this stuff for you, you know, they could maybe offer to tell you where the cafeteria is, because I still don't know where that is either. I just know that front section because it's next to the parking lot and you have to go through it. But if I could find the cafeteria, maybe they offer bagged lunches. I don't know. Maybe they do, but we usually bring ours. So I bring a giant purse full of granola bars and all kinds of stuff like that, because once you get in there, you don't know how long you're going to be in there and you don't know where the food is. So
I think that they need to dummy it up a little bit, and I'd be happy with a cartoon version or a comic book version of here's what you need to know when you're coming into the big city, because some of us, and I lived in Halifax, Dartmouth, so I'm okay when I travel. However, I'm coming from Cape Breton, and some of the smaller areas of Cape Breton, you're going from one main street to a lot of traffic, which is stressful. Bridge fares are stressful. Which lane you go in that you don't have a MAC pass? What is a MAC pass? Silly things that I think anyone in Halifax would take for granted out of necessity rather than anything else. But I think that there, you know, there has to be a going to the IWK book for dummies that says, you know what, we understand that you've not been here before. Here are, like you said, Tamara, here are the places to go. Here are the things to see. You know what? We shouldn't have to worry about, we shouldn't have to make sure we have a lot of extra change in our wallet and our granola bars. We should know that there's going to be a place there that we can go to the vending machine. There's going to be a place we can go for change. We should know how much we have to pay for parking. How does the parking system work? Because even if you go down to Smitty's, you need a degree in technology to figure out how to make that parking meter work and understand that you can park anywhere on that street as long as you went to the machine 5 meters up the road. And it's all rocket science to somebody from a smaller community. So a dummy up book in big dummy words for big dummy moms would be wonderful.
Yeah, I think it would be great if they would help families that are less fortunate or have low income. If there were like maybe grants or special things like to help with gas money or to help with bridge tolls or to help with getting around the city, finding food, vouchers for food, just anything to help lessen the expense. Because I mean, I've gone there, I've been going there for a few years with my daughter because she has issues with her eyes as well. I couldn't imagine, like, if my child had cancer, the amount of money that I would be spending, waiting for my child, like for all the appointments to go back and forth. Like if I lived in New Brunswick, I would almost have to move to Nova Scotia and live there in order to make it easier to have my child be seen at the hospital. Like it must be really unfortunate for somebody that's low income, their child gets cancer and then they have all these extra expenses that they didn't plan on. That's what I think the IWK needs to focus on as well, is the expense of being in Halifax and being there, and how to alleviate some of the expenses.
And it's specifically in the back of my mind because when we were there a couple of weeks ago, one of the big complaints I had, and my daughter and I kept saying, was that we wish there was a map of like you are here. And if you want to get anywhere else in the hospital, here's how to get there, rather than having to ask for directions every time we wanted to know. We only spend time there just for basically appointments. We've never had a long stay. So it'd be nice to know how to get to Tim Hortons or Subway, or we still haven't found the cafeteria.
So a little bit of a help in wayfinding and helping you kind of locate how to go about. How do you want to have that kind of assistance? Like what would it look like to be practical to you? What the tool?
I know Ronald McDonald House is there, but I would love to see the IWK have some other, like even have their own hotel. Because Point Pleasant Lodge is okay, but I can't imagine staying there with younger children. I mean, there's nothing to do there. And there's no amenities either. Like they don't even have coffee pots in the room.
To kids that are having mental health issues, that there's more of an emergency room or an emergency stream for them. That it's more than, okay, obviously you're in distress, we're going to try to help you, but until Dr. J is open, it's a 9-month waiting period. You're going to have to wait 9 months before we can have someone see you. Or that if there was more of that sort of more immediate assistance, I think that would go a very, very long way into helping kids in Nova Scotia. That you come in, you're in distress, they can get you towards a specialist that isn't 5 or 6 or 8 months out.
I wonder if there would be a way to be kind of preemptive approach of going into the emergency saying, well, my son's got a broken arm. You call a number like the 811, say, my son's got a broken arm. This is okay. Can you be there in half an hour? And then when you're there in half an hour, they've already got some of that prepared, ready to go. You come in, they pick up that baton, and it kind of alleviates the whole scramble in the emergency room. And you could kind of preemptively alleviate that burden on the waiting room. That's just a thought.
So instead of trying to branch out to new areas, I think they really need to invest in the coverage that they're already providing, and either hiring more specialists or trying to find ways to streamline the care that they're giving with them, because they're already under-resourced for the services that they do provide now.
So there should have been more consistency, more proactiveness in explaining how things work, why they work that way.
So when my wife had a surgery there, and so was my son, and they sent out a letter beforehand that's supposed to tell you what to expect, but it's a very broad and general, and it didn't really address a lot of things. So there were things in it that didn't even apply. And it was kind of unsettling to go in and know that you having something major happen and not have very little idea how long it's going to take, or whether it's worth trying to find a place to stay in the city because it's going to be overnight, or even just how to whether or not you're supposed to eat. It says, with the general anesthetics, what time to stop eating, but it's not always clear if that's even going to be part of the procedure. Like my wife had gone in for something and she got that form, and then it turned out there was no general anesthetic, so she would have been fine. So that was, added stress and anxiety with, being hungry and not even needing that where that wasn't even the case. So it's, I think it would go a long way if they put a little more effort into just making sure people understand what to expect when they go in.
I really truly believe there's not a person that works there that doesn't care about kids and women. And that was really comforting to me. That even when things were going wrong, I told you about the adults showed up, even the people on the weekend were doing their best. And that's how I feel about the IWK, that if you said to me, the IWK, we love you all, I totally believe that.
It's one of the greatest memories of my life. Walking up and down that hallway, everyone was so, it was a great experience. Although we had complications, it was fantastic. And it's hard that's an emotional connection with the IWK. But it would nice to see it at like a world-class facility. That would be great.
I would like to see a comprehensive high-risk breast cancer screening program for the province based out of the IWK, where our high-risk ladies and men could come in and, once a year get their mammogram, their breast MRI, meet with the surgeon, and have it all done locally by the same team, rather than the family doctor struggling to get these MRIs in their local communities and then calling me because they can't access it.
I can't give them what they need. They have to go see a doctor who's going to come back and tell them the same thing that I just told them. And it's very wasteful in the system. But there's lots of other stuff. If we could do something in a collaborative model, maybe that paramedical type stuff would be certainly quite helpful. I always talked about the golden rule, do unto others as you want done to you. But then I learned that there's now the platinum rule, to do unto others as they want you to do unto them.
Parents will bring in kids in on Monday, Wednesday, and Friday to see 3 different specialists that are taking care of that kid. It'd be nice if we could put them together so that the 3 specialists can work out if they have Crohn's, for example, and they have low iron and they're anemic and they need to take iron pills, but that also binds them up and impacts their Crohn. The specialists can talk back and forth and decide the best path, rather than the patient having to force that issue back and forth between people. So I don't know how we do that, but it would be good for the patients.